We are demonstrating hip fixation nail on a saw bone. This is left femur bone, and we'll be marking the entry point for hip fixation nail. I have marked with the marker pen over the greater trochanter, which is medial to greater trochanter, and in the line with the shaft of the femur. This is Dr. Gonzalez's owl, which is curved and long with a sharp point. It has a double offset, one over here, one at the entry point, which can be negotiated medial to greater trochanter, and it facilitates the ease of entry. The fracture is reduced very nicely. Now I am taking the entry with the at the marked area, wherein you make an entry. Okay. Once you have made an entry, now I will be passing a guide wire. A guide wire is bent at a tip. 15 to 20 degrees angulation is done for easy negotiation. So in this way I pass the guide wire. It is entering into the canal. Once it is entered, this guide wire is checked under C-arm whether it is passed or not to confirm. This is a triple reamer, which is tapered end, having 15 millimeter at the proximal most portion, used to enlarge the entry which you have made with the owl. It is to be passed over the guide wire. In this way, and you have to enlarge the entry of the entry hole which you have made with, which is entering inside. After passing the guide wire, you have enlarged the trochanteric entry point. Now guide wire has been passed, and I am passing the hip fixation nail assembled over the jig. It is just a gentle passing of the nail inside the. Okay. Once you have passed the nail with the jig, now you maintain the version. So by tilting the jig posteriorly, you achieve the anteversion of the neck of femur. Now I will be passing the guide wire through proper sleeve into the neck region of the femur. Okay. So now I will be passing the guide wires, removing the guide wire sleeve and putting the drill sleeve for making the hole bigger. I will 5.5 mm drill. Now I will be drilling over the guide wire which has passed in the cervical region. Now I will be passing the 8 mm drill. This is the sleeve for 8 mm drill, which is inserted into the main drill, sleeve, and this is main drill, 8 mm drill for cervical screw. Passing over the guide wire. This is the second drill. I have drilled for the cervical screw. Now this is HFN screw. The length came about 80 millimeter from the guide wire, and now this is a connected screwdriver. Now I will be screwing this screw over the guide wire. Now I remove the sleeve to show that the cervical screw is going inside the neck of the femur. I am fixing the hip fixation screw through the sleeve. This screw appears like this. It has trenches over the shank, and it has a head. So the head gets obstructed at lateral wall. So it acts as a buttress over there, and the compression which is achieved is not lost. This is the head. This is the perfect placement of the head of the cervical screw. Distal interlocking It has a facility on the jig itself, touching the sleeve. The sleeve is touching the bone. And now I will be drilling through the drill guide. Now I will remove the drill sleeve and I will be passing the interlocking bolt, which is pre-measured with the depth gauge, passing through the sleeve, and now we are doing interlocking. Once it is inside, you can withdraw the sleeve to see the screw head, and this is locked. This is the top screw, or also called as anti-rotation screw, which is fixed in the proximal end of the nail. So it goes inside. As you tighten it, the head of the AR anti-rotation screw gets flushed with the nail. Now once it is tightened, it goes and lodges into the trench of the cervical screw. So it locks the cervical screw, preventing rotation. So it is called as anti-rotation screw. Okay. Now how to check whether the anti-rotation screw has lodged into the cervical screw or locked the cervical screw. So you take two screwdrivers, one in the head of the cervical screw and the other in the head of the anti-rotation screw. So once the anti-rotation screw is tightened, the screw should not move. It should not rotate. That means the anti-rotation screw tip is lodged in the trench of the cervical screw, locking it. So there will be no rotation at all. See, this is the fixation. Okay.